WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. Brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio today, Paul Skowron, CEO of Warner Hospital and Health Services. Paul, good to see you, sir. How are you?
Good morning, Seth. I'm doing fine.
Summer allergies hitting you hard at all this year?
You know, I think I told you before, I decided I'm not going to take allergy pills this year. So far, it's worked out, but with these kind of storms that are coming in right now, the sinus pressure is a lot, and I might have to cave in as we get into July here.
Sure.
With the tassels and the corn growing and all that.
Yeah.
Central Illinois can be brutal to allergies. So
yes, indeed.
we'll see.
Indeed. Yep. See how long we can hold out, right?
That's right.
Yeah, I've kind of taken that approach myself. Can we make it through? We'll see if we can. So very good. Very good. Well, Paul, I know as we talked this morning, you know, I was thinking back on our last conversation when we were prepping here for what you want to talk about. And, you know, I remember asking you in I don't know, May, mid to late May, is anything new coming to the hospital, working on new partnerships? And I know that's always kind of top of mind for you and how we expand services in Clinton and continue to serve the community. How about just the importance of those? And then we'll dive into the expansion of an ongoing partnership. How about it?
That's great. Yes, the success of the hospital. You know, we are one of the last independently owned rural hospitals. However, that success is really born on our partnerships. And I can go through a long list of partnerships. Think about our radiology reading for our x-rays, our imaging. That's done by Decatur Memorial's radiologists, and few people know that. When we look at the specialty clinic, we've talked about the opening of the West End and the access for the specialty clinic, but the success of the number of specialists that come to this specialty clinic really has taken many years. And we can look at HSHS's Prairie Heart and Dr. Murphy. He's there twice a week seeing patients. We've got Dr. Clark, the GI from Bloomington Normal, coming there twice a week. And the number of specialists from Gibson Area Hospital has increased dramatically in the last year, with a neurologist, Dr. Tazuddin, and the urologists that have joined us recently, Dr. Pena, Dr. Farshad, the rheumatologist, and Dr. Keller, the orthopod, and a number of others from Gibson area, Dr. Glickstein, the ear, nose, and throat, who just doubled the time he's seeing patients because of the demand from our family medicine primary care doctors. So these things take time to build a reputation of having a stable of specialists that the family medicine doctors can rely on and the public becomes aware of. So having said all that, an expansion of our partnership is Dr. Sid Rorscheib. He has had Illinois Bariatric as his practice, specializing in bariatrics for years and years. He is bringing that practice into family medicine. And I'm really excited about this because what he's also going to be doing is expanding his general surgical practice. And our ability to leverage that is something we haven't been able to do in the past, as far as what our emergency room transfers out, the kind of general surgical procedures that we transfer out. Dr. Rorscheib will now be available to take call from the emergency room. So Dr. Rorscheib will be here, and he'll be taking care of, in general, abdominal pain issues related to adhesions, gallbladder, any type of hernia you can think of. He has done these kind of surgeries over time at our hospital, but not in concert necessarily with the emergency room. So this is something, this coordinated care is something that we're working on with him. And he'll take patients to surgery to remove adhesions, gallbladders, and he can excise cysts and lipomas in the clinic or in the OR, but he's also brought his entire bariatric practice into Warner. So these things called sleeve gastrectomy procedures and lap bands, these are specific languages for bariatric patients, overweight patients, and so forth. But those have declined as GLP-1 drugs have become, popular.
Yeah, sure.
And that's why it is a great time for us to help him expand his general surgical procedures at Warner Hospital and coordinate with Warner's ER for things like abdominal pain, appendicitis, appendectomies, emergency gallbladder removal, small bowel obstructions, food gets stuck. We've handled those things in the emergency room, but then transferred those patients to the larger hospitals. And he will be on call with the emergency room to take care of those procedures. So here is a new partnership that we're very excited about. And this will take time to grow, just like all of the other specialists that have joined us over the years.
Gotcha. Now, was he with Warner at one time? Am I remembering that right?
He's always had privileges at Warner for the last 20 years.
Okay.
But the amount of procedures that he did here were by and large the bariatric type procedures and GI type procedures in concert with Dr. Clark. But now he'll be expanding those other general procedures.
Gotcha. Very good. Warner Hospital CEO Paul Skowron in studio with us here for this morning. Paul, I know you do a lot of things like advertise with us to promote, new specialists and the services of the hospital and those sorts of things. Is it also largely just word of mouth, or are there other ways to grow, the folks that come in and grow the I guess the community's utilization of the hospital? How about that side of it?
Yes, besides radio, we do access Facebook for sure. But word of mouth is really important when folks find out. We have advertised the new access on the west side, but it's until people actually have the opportunity to park right next to the specialty clinic and walk right in. I watch every day, and I come out and help sometimes with the patients that are in wheelchairs or are trying to get out of their car as they're being dropped off, and they've got canes and so forth. So I like to help them get up the stairs. But just to walk right in and be able to sit down and have the staff from the specialty clinic greet them, that kind of experience gets out in the community, and it takes time, but they spread the word. And then as those patients come to see their family medicine specialist, they discussed what they've seen over at the specialty clinic. And so they're able to have a broader discussion of the type of specialists that we have here.
Very good. So an expansion of the partnership with Dr. Rorscheib is coming to Clinton, and sounds like he'll be very available to the facility and those sorts of things. In addition to that, I know, Paul, these things are always ongoing for you, but anything you're focused on in terms of whether it's services the community needs that you're trying to bring, any updates there for what could be next along those lines?
Okay. Well, we are operating at budget, but that's basically a break-even budget. We have a $42 million budget, and our revenue is matching our expenses. But looking forward, and we factor some of this into the budget, is the $1 trillion in Medicaid cuts that are coming that will start to bite harder in 2027, effective January 1, 2027. What the government has done is issued rural healthcare transformation grants. We have applied for those grants. We won't know until July if we were successful, but if we are, we have a list of service expansions that we would like to explore. For instance, right now we do infusion therapy, but it is not for cancer. It is not oncology. It is not chemotherapy. We think we are capable of that, but we need these grants to be successful so we can have consultants explore whether or not our pharmacy director believes that we are capable of expanding in those directions. So those kind of things are not in the budget, but but they are the type of service expansions that I'm looking to explore in the future.
Yeah. You talked about that $1 trillion cut to Medicaid. How impactful is that going to be for the hospital?
So 25% of our patients are Medicaid. 50% are Medicare. The other 25% are commercial insurances of many kinds. And so we don't know the total impact on our Medicaid patients yet. But in addition, there is the reduction of ACA coverage for the employers that buy their own insurance. That will hit harder. Their premiums will go up in January 1, 2027. So all of these things is a matter of access to care for patients who, and in general across the country, we're already seeing patients hold back on necessary care, preventative care, and things like that. So we factored some of that into the budget, but it is really hard to predict in a particular community what the impact will be.
Got it.
And that's why these partnership expansions are so important.
Right, exactly. Grow that revenue, right?
Right.
To make up for that shortfall. Makes a lot of sense. Very good. Paul, on that note, I look at the clock. We could use a break. Did I miss anything in that conversation? Whether it's cuts, whether it's budget, whether it's partnerships? Did I miss anything in all that you want to put out there for us?
No, well done.
Very good. Paul Skowron, CEO of Warner Hospital and Health Services, is my guest in studio here this morning. Take a break. More to come with Paul on the WHOW Morning Show.
WHOW. Your friend in Central Illinois, WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Again, my guest in studio today is Paul Skowron, CEO of Warner Hospital and Health Services. And Paul, I tell you what, a couple of things to put on the radar of folks. Let's start with the Foundation annual golf outing. When is this? Where is this? What do we need to know?
So the golf outing had originally been planned for late August, but an opportunity came open at the Clinton Country Club for Friday, July 17th. So we jumped on that. And so that's coming up pretty quick. Friday, July 17th, 8:30 registration, 9:30 tee off, lunch provided. So the Warner Hospital Health Services Foundation is the one that's putting this together. And it's actually Ryan Utterback that is overseeing this and had coordinated this for us. He's at 217-620-5332.
Mhm.
If anyone would like to contact Ryan Utterbeck. But we also, on our Facebook page for the foundation, we've got all the details of the golf outing.
Gotcha. How much is it? What are some of the perks of the outing this year? What do we got going on, Paul?
I don't know.
Oh, okay.
Since this is terrible, but because I'm not a golfer, I don't pay attention to what it would cost to register.
Okay, gotcha.
And that's why looking at our Facebook page or calling Ryan Utterbeck is the better option.
Sure. So Foundation Golf Outing comes up on July the 17th. And Paul, you mentioned it, the foundation. I know they support the hospital in so many ways. Just talk about their support and what it means to the hospital.
So in addition to providing equipment that is not budgeted, that might come up as an emergency or other expansions in the past, equipment for the physical therapy department and so forth, the foundation provides scholarships for the high school students, those that indicate that they are going to pursue a health-related career. And so in May, I think $8,000 worth of scholarships were provided to a number of students. And that's always helpful to tie the community into remembering Warner Hospital and Health Services. And we hope that those students will someday come back and practice in Clinton and in DeWitt County.
It's an investment in the future, right?
That's correct.
Yeah, sure. And I know they've helped in a material way as well. If I'm not mistaken, like signages and equipment. What are some of the ways the foundation has helped the hospital in those areas?
You're right. You're bringing to mind wheelchairs for the emergency room, exam tables, specialty exam tables for large patients in family practice and in the walk-in clinic. Over time, there's just a whole bunch of amenities in the hospital that one can attribute to the foundation. And now I'm going back all the way 11 years ago. 3D mammography. They were very instrumental in providing the equipment for 3D mammography.
Sure. Yeah. Well, and again, in addition to those things, I know, when folks apply for financial aid and the like, that also comes from the foundation, if I'm not mistaken, right?
You're absolutely right. For patients that come through the family medicine and perhaps an expensive prescription comes up that insurance will not cover and they can't afford it, there is a fund within the foundation and we can access that fund for the patient.
Sure. Very good. So one more time, Paul, if you don't mind, the when and the where and how folks get information on your golf outing.
So the golf outing for Warner Hospital and Health Services Foundation is Friday, July 17th in the morning. Registration starts at 8:30. Tee off is at 9:30. Lunch provided, 18 holes, and it is on the foundation's Facebook page. We also have Ryan Utterbeck as a contact, 217-620-5332.
Very good. Check it out. Be a part of that. Is there a deadline to register? I don't know if we mentioned that or not.
No. You can take your chances and wait till 8:30 of that day.
All right.
But it's always best to register
ahead of time. Sure. Very good. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio here for this morning. Paul, what else is kind of keeping the hospital busy? I know the Safe Sitter class is always very popular. I saw a little bit of a blurb for that on the billboard that sits outside the hospital. How about the Safe Sitter class?
That's right. June was all filled up. I just watched all the young folks come out of the Safe Sitter class the other day, and it's always good to see the youth get excited about these things. They were still talking about it as they were exiting the building, and it doesn't make sense before school starts that the younger folks would want to get trained to be sitters for when school starts again and people want to go back to work and they want to have already booked their babysitters or safe sitters for whether it's elderly or for the young folks. So in July, I don't know the exact date, but one should look at the hospital's Facebook page and look at activities in the Wellness Center. So there are still opportunities within July to book some appointments for safe sitter classes.
All right, very good. So be a part of those. Did you say who leads those, or like what the kids are learning, or anything like that?
I don't know exactly who's leading them. I do know that is a very structured course that instructs the students on how to handle emergencies.
Mhm.
What happens if there is a fire and you're responsible for those kids? What happens if the kids get sick? Call 911.
Mhm.
All the steps to go through for a variety of emergencies.
Sure, very good. All right, Paul. Well, with that, I've got about a minute. Anything to kind of wrap up the conversation today you want to put out there for us this morning?
Well, we did talk briefly about the challenges of the upcoming year with Medicaid cuts that will take effect. It's called HR1. And we are bracing ourselves for the financial impact, because it's just so difficult to tell how many people might be affected by these kind of cuts. And we are also trying to take advantage of the rural health transformation grants that I have applied for, the hospitals applied for, and see if we can get the maximum amount of dollars to help those folks in the future.
Gotcha. Very good. Very good. On that note, Paul, what's the best way for folks to keep up with all things Warner Hospital and Health Services?
Our website covers all of our services. However, our Facebook page also is very popular.
Very good. Paul, always good to see you, sir. Thanks for making time for us.
Thank you, Seth.
Paul Skowron, CEO of Warner Hospital and Health Services, is my guest in studio this morning. Again, the morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Network news comes your way next on the WHOW Morning Show.
WHOW.